Okay, so we have some people in the room. We'll go ahead and get started. Thank you all for being here today. We have a really great session planned. I think we had originally talked about doing this over the summer, but I think with everything going on, we thought it would be wise to move it up. Um, so before we get started, I just want to say thank you to STCU, our program partner. They've been incredibly gracious as we transition to our physical in-person workshops to an online webinar forum. Thank you to STCU. Just mark your calendars for next week. We have Zach Mason and Krista Patterson on Wednesday and Thursday going over Facebook marketing and Instagram marketing. More information to come there. And again, for those of you who just came in the room, feel free to submit your questions in the Zoom chat box or the Facebook comment section. Just because of the content we're going to be covering, we're going to hold questions until the end. So feel free to submit them throughout the session and we'll address those at the end. But without further ado, I'm going to turn it over to Dr. Jessica Schneider, MD, with Empowered Health Institute, and she will take it from here.
All right, so I'm going to go ahead and share my screen to pull up this presentation here. And I am curious, does this, it looks like I can't do a full view there, but we'll make that work. All right, so again, thank you, Logan, for that introduction. I am Dr. Jessica Schneider. I am board certified in internal medicine, and I am the owner and founder, CEO of Empowered Health, and we're located in the Richland Parkway. We're a membership-based clinic. We do primarily primary care, and our goal is really to take a holistic health and wellness approach to help people feel better. And so, along those veins is the content for today's talk about depression and anxiety during our COVID pandemic, and really looking at a holistic integrative approach to how we might both feel empowered and hopeful that there's a way to improve things and to take back personal control. So without further ado, I will go ahead and get started. And again, it looks like things are a little bit different in this view. Oh, look, that worked. Okay, so this is a picture of the coronavirus, our novel SARS-CoV-2, and this is actually from the first US positive case, and this is from the CDC, and what's colored blue here is actually a picture of the virus, and this is lung tissue, and it's actually very deconstructed. This is damaged tissue as a result of the virus and the inflammatory process, but what you see inside the blue are these little black dots, and that's actually part of the genome of the virus. And it's just amazing to me that something so small can have such a global impact, as we're trying to figure out how to prevent the spread of this virus. And now we've been on a stay-at-home order for over a month at this point. So what do we know about how this is impacting mental health? Well, and I will tell you, I look at the research daily on coronavirus, and there's more papers being published on this one topic area than I think we've ever seen on any specific topic, and in the time frame that things are being turned around. But so mental health is one of the questions that's being asked about. This study is actually a compilation of 4 different studies that came out of China, looking at really early indicators of mental health shifts. And this was, in these studies, people were asked about anxiety and depression. As you can see, about 16 to 28% reported having anxiety and depression. So almost a quarter, 1 in 4 people. And self-reported stress was at about 8%. Personally, I think these numbers are a little bit low, just from talking with my own patients and friends and family. So what about looking back at past experience? So we don't have something to the magnitude that we're dealing with right now with the SARS coronavirus, but if we look at the SARS outbreak back in 2003, we can get a little bit of information. But you have to remember, the SARS outbreak in 2003, there was only about 8,000 worldwide cases and only about 770 deaths. So again, not the same magnitude of what we're seeing here, but what was published at that time is that there was an increase in mental health concerns during that time frame with depression, anxiety, panic attacks, psychomotor excitement, psychotic symptoms, delirium, and suicidality. So what we know is that mental health concerns are present. They're increased from our usual baseline, and that we need to take action now. So this slide is just to give you a general idea of what your doctors are thinking about and looking at when they're trying to make a diagnosis of depression or anxiety. So for depression, you know, obviously depressed mood, loss of interest, changes in sleep, changes in appetite, poor energy, poor concentration, guilt, and often feelings that you might be better off dead or wanting to self-harm. For anxiety, we're talking about excessive or persistent worry that causes significant distress. And oftentimes for a classic diagnosis, this has to last for longer than 6 months. Being easily fatigued, concentration difficulties, and sleep disturbance, as you see, is part of both of these diagnoses. So the point of showing you this is to give you a little bit of insight into what your doctor's looking for, your medical professional. But even if you don't meet these exact diagnostic criteria, does not minimize the pain or suffering that comes with even part of these symptoms. So some information and some things for you to be aware of and to look out for in yourself and your loved ones. So let's look at some statistics here. And again, I'm sorry you can't see this entire slide, but we can show. So the World Health Organization estimates that depression is the top leading cause of morbidity and mortality. And morbidity and mortality are fancy medical terms for poor health and death. So mortality is greater for those who have depression than the general population. This does include suicide. Those with depression don't live as long. Depression absolutely has effects on overall health, particularly diabetes, heart disease, Parkinsonism, and we're now starting to wonder if it's a risk factor for dementia. And this is the about 800,000 deaths per year are estimated to be from suicide by the World Health Organization. What about anxiety? So the lifetime prevalence of anxiety is 5 to 12%. So 1 in 10 or 1 in 20 individuals will experience generalized anxiety disorder in their lifetime. So very, very prevalent. And what about the health effects of anxiety? So we know that anxiety is related to cardiovascular risk. With excessive worry in particular, something called heart rate variability is affected. So heart rate variability, let me speak to this briefly, because this is becoming a more popular term right now, and it's often not understood well. So we have 2 nerves that go to the heart, 2 main nerves, and they control heart rate. Now, one nerve is responsible for fight or flight or your stress response, and one nerve is responsible for the relaxation, digest, rest, and that is the parasympathetic nervous system. And so depending on which nervous system part is more active depends on how fast your heart rate is and how variable it is. So when we're more relaxed, we actually have an increased heart rate variability. When we're more stressed, we have a diminished heart rate variability. So we see this with someone who is anxious and has excessive worry. There's a diminution in heart rate variability, and this can be measured. What does this do? Well, it increases the risk for high blood pressure and the requirement for high blood pressure medication. So we're humans, and with most things, we have contributing factors. So anxiety and depression are no different. It's oftentimes a sign of something else that's going on in the body that's either a deficiency or a hormone imbalance. So I thought these would be good for you to have, because this is something that you can go and talk to your own doctor and say, you know, I'm experiencing these symptoms and I'd really like to rule out these contributing factors. So for depression, we're thinking about zinc deficiency, imbalance in thyroid, HPA axis disturbances. Again, this is related to cortisol and that stress response system. And then neuroinflammatory pathways. So inflammation is being found to be a root cause of many of our chronic diseases, and depression is no different. So how do we become inflamed in our body? Well, often it's not enough sleep, lack of exercise, and an inflammatory diet. And I'll speak more to that in a little bit. What about anxiety? So lead toxicity has been linked, and this is especially important in kids. Hyperthyroidism, again, is too much thyroid hormone. Substance use disorders, so we're thinking about things like alcohol, caffeine, your energy drinks, And then of course, illicit drugs. B12 deficiency, hyperadrenalism, again, the HPA axis and too much cortisol. And then here we see inflammation again. So what do we do with this information? How do we start putting the puzzle pieces together, especially if you're experiencing symptoms yourself right now, or you know somebody who is? So my goal is to give you some steps on how you can take action. So the first thing you can do is have a medical consult. Get in with your doctor, find somebody who is experienced in working with anxiety and depression, and get a history and a physical. A lot of the contributing factors that I just introduced can actually be picked up on a physical exam. There can be clues. A PHQ-9 and a GAD-7 are both questionnaires that you can fill out and that your doctor should be using to track your symptoms over time. And then, of course, there should be conversations about any substance use. Request labs. So I would say about 50% of the time that I talk with patients about their anxiety or depression, they've never really had some of this blood work done. And that's very concerning to me because, again, we just talked about contributing factors. So if you have too little thyroid hormone and you're depressed as a result of that, well, the solution isn't giving you an SSRI or Zoloft. The solution is treating your thyroid problem. So these are some examples of labs that should be checked. And this is something you can take to your doctor to ask about. So with depression, untreated, the median time to recovery is 20 weeks. That is an incredibly long time, and that's not even necessarily a full recovery without relapse. So what are some tricks and tips that you can use to start feeling better? Well, conventional therapy is conventional because it's what most people recommend or get recommended if they see their primary care provider. And this includes medication and counseling. And what studies have shown is that the combination of using medication plus counseling or psychotherapy actually has the best chance of preventing relapse. So I do encourage all of my patients to explore the idea of seeing a counselor or having a therapist. And we have a lot of really great therapists here in the Tri-Cities. And so talk to your doctor about recommendations. Often, it's the same thing with any human interaction. Personality matters. So if you don't fit with the first therapist that you see, then try somebody else, and that's okay. The most conventional medications used are what are called the SSRIs and SNRI class of drugs. So that stands for selective serotonin reuptake inhibitor and selective norepinephrine serotonin reuptake inhibitor. Basically, we're working with neurotransmitters in the brain, which if you have too little of, can lead to symptoms of anxiety and depression. So I listed out here the classes or the medications that fit into the classes of SSRIs. You've probably heard these names. I use these all the time. These are good drugs. Now, the most common reason that people come off these medications is related to side effects, and I've listed these out down here. And they can be pretty significant. I usually tell my patients that the first week you start a medication from one of this class, you will have headaches and nausea, and it's going to go away, but that it's going to be present, so don't be surprised. Now, the whole point of this talk, again, is to give you a wider tool basket than just medication or therapy. And I like to point out to my patients that using these conventional therapies, in addition to everything else I'm going to tell you here in a little bit, makes it so that you need less medication and therefore the side effects are not as significant. All right, so without further ado, let's get into the integrative approaches. Okay, so a little disclaimer here, definitely want you to be talking to your health provider before implementing any of the treatments that I'm going to talk about. I've intentionally not given dosing on here because I don't want you to take this and just implement it on your own. Even though most of the things that I'm going to be recommending here are very, very safe with little risk of harm, that they're not 100% risk-free. Okay, so please talk with somebody who's knowledgeable with this information. All right, no surprise here, exercise is absolutely on the list. Plenty of studies shown that people report better mental health when they're regularly exercising. Now, 150 minutes a week is what's routinely recommended. However, if you're actively feeling depressed, this can feel impossible. Getting off the couch sometimes is a challenge. So what I tell my patients is start with something so small that you couldn't not do it. walk out to the mailbox, walk to the end of the block. If you can do that, the next time go around the block, okay? So it doesn't have to be 30 minutes on a treadmill 5 times a week to start seeing benefit. Any amount of movement is going to help. Sleep. So insomnia itself is a predictor of a depressive episode and also increases risk for relapse of depression. I cannot emphasize the importance of sleep enough with both anxiety and depression. We talked about how contributing factors are HPA axis disruption, and that's cortisol. Stress is tightly linked with sleep. And so this is something, and of course, you know, both with anxiety and depression, sleep disturbance is part of the diagnosis. So please work with your doctor. There's short-term strategies and there's long-term strategies. So short-term often requires medication, and there are prescriptions for this, and there's also really great supplements that also help with anxiety and depression themselves. So work with your doctor on getting sleep. Ideally, you would have 7 to 8 hours of night. I often give my patients a sleep hygiene handout so that they go through, make sure that temperature is appropriate in the room, you're not using electronic devices 2 to 3 hours prior to bedtime. All of those things are great long-term strategies, but often in the short term with anxiety and depression, they're not enough. So work with your doctor. Diet, also not surprising. So we also talked about inflammation being a large contributing factor for anxiety and depression. And the biggest way that we can affect inflammation in our bodies is through our diet. And we have studied this. The Mediterranean diet, I'm sure all of you have heard of that, is a very good anti-inflammatory diet. And what are the tenets of this? So a Mediterranean diet is rich in low glycemic index carbohydrates, phytonutrients, and healthy fats. And so without giving you an entire nutrition lecture here today, what does this mean for you? How can you start doing this today? Well, avoid sugar and refined carbohydrates. Take out the white stuff. Okay, so that's step one. If you do that, you're going to be much more likely to be having lower glycemic index carbohydrates. Eat whole grains, you know, rice, quinoa, things that you can actually see the grain. Eat olive oil, tree nuts, avocados, and olives. You should be doing this daily, and you're going to be getting some really good fats in your diet. And then finally, eating 6 to 8 servings of fruits and vegetables a day. And the emphasis really should be on vegetables. Fruits are wonderful, but again, depending on the type of fruit, they have more sugar and they're higher glycemic index. So this is where you can start. I work with patients on nutrition all the time, and if I was to give you the one thing that I see the biggest benefit from, it's implementing this anti-inflammatory Mediterranean diet. All right, supplements. So, you know, there's hundreds of supplements out there, and unfortunately with supplements, they aren't FDA approved, which means that one fish oil, for example, is not the same as another. But if I were to give you 3 supplements that are the most beneficial for anxiety and depression, it's the ones that are listed here. So fish oil or omega-3s, B vitamins, and inositol. So fish oil, and this is particularly, again, omega-3s, definitely treatment effect. We're not getting enough of this in our diet. You know, fish oil is called fish oil because it comes from fish, and you can really only get it from cold water fish. So we're talking about things like salmon, mackerel, anchovies, sardines, herring. I don't see a lot of my patients consuming these types of fish, maybe salmon with the exception, but in our region, we just don't get a lot of it. So supplementing is absolutely a good idea. It's actually a great treatment too for postpartum depression. In particular, for whatever reason, it's been shown to have a huge treatment benefit. B vitamins, one that's been very well studied for depression is folate, which is actually, it's B9. And individuals who are depressed are often low or deficient in B9, and treating with that supplement alone provides benefit. Inositol is a carbohydrate compound. It can actually be found naturally in some foods, and then our bodies can independently make it. Taking inositol has actually gone head-to-head with SSRIs in trials and shown some benefit. So this is another one that I absolutely recommend starting. All right, and now I'm going to introduce you to 2 of my favorite botanicals. So botanicals are plants that have some pharmaceutical benefit. We haven't heard of these because it's really challenging for a pharmaceutical company to go ahead and patent plants. So We've done a very poor job in our country of making this widespread knowledge that there's so many wonderful botanicals out there that have treatment effects. In Europe in particular, something like rhodiola is a very commonly used botanical with, it's a household name. Again, not all botanicals are made equally, so it matters what type of the plant is isolated, and so using medical grade supplements or medical grade botanicals in this case is a really good idea. So rhodiola, very beneficial for anxiety and depression. This randomized control trial here that I've shown went against sertraline, which is one of our, it's Zoloft, or one of our SSRIs, over 12 weeks, and they had similar outcomes, so similar benefit for treatment. And guess which one had fewer side effects? The rhodiola did. So this is a great option. I think this one works really well. It's not without side effects itself. So again, this is where it's important to work with your doctor. Passionflower. So this is another wonderful one. This one has probably better benefit for anxiety. It's been studied against oxazepam, which is a benzodiazepine, which are very classically used for anxiety and panic attacks. The benzodiazepines are highly addictive. And so having a tool like Passionflower, which is not addictive, is a great option. This can also help with sleep. All right, so what about some tools that you can use that don't require you to ingest something? So bright light therapy is a wonderful option. So you can go to Amazon, buy a bright light, get something with 10,000 lux, and start using it. My tips, I recommend starting with less time. So, because if you start with the full 1 hour right away, you may have headaches or jitteriness. Ideally, you would use this in the morning to help with the circadian rhythm, that natural, bright light and cortisol levels higher in the morning. You work up to the full 60 minutes, and this may take 2 to 5 weeks to get treatment benefits. So this is part of your long-term plan, not necessarily a short-term quick fix. All right, acupuncture. I love acupuncture for anxiety. It has also been shown to be somewhat effective with depression. The biggest issue with acupuncture trials is just the difference in, of course, the length of the treatment, who's providing the treatment, and the points that are used during that particular treatment session. So we do have a handful of acupuncturists in the Tri-Cities, and they do a great job. But again, get specific recommendations from your doctor. So now we're going to touch base on a few mind-body treatments. And again, when we're talking about that HPA axis, the heart rate variability, and being able to tap into our relaxation response, that's where mind-body treatments come in. And so one that has been well studied is Tai Chi. And it has lots of benefits on mental health, including depression and anxiety. The thing that I love about Tai Chi is that it is also great for building balance. So if exercise and balance is something that you're concerned about, then Tai Chi is a perfect place for you to start. And thank you, YouTube, because now we can get access in our own homes for free, for the most part, for some really great instructors for things like Tai Chi. Yoga, also similar benefits. There have been lots of studies looking at yoga and mental health. Again, same mechanism of action that I described. Even short periods of doing yoga, 10 or 15 minutes a day can start to provide benefit. So add this one to your repertoire. Other mind-based therapies, breathing techniques. So we teach the 4-7-8 breath at Empowered Health. And the thing you need to know about deep breathing is that it's more important that your exhalation is longer than the inhalation, and that long exhale is what is activating the relaxation response. So deep breathing exercises are things that you can do in the car, in the shower. You can implement this at many points throughout the day. And so I teach patients to do this twice a day, and practice it pretty consistently over a month, and start to notice how you can actually feel the relaxation activate when you do this. Guided imagery is a great tool. We talked about yoga and Tai Chi, progressive muscle relaxation, clinical hypnosis, meditation. There's tons of apps out there on how to do all of this. This is not new information, but finding something that you enjoy doing out of this list is really important, and then making it a practice doing it regularly. All right, so I thought I would just introduce, so we've talked about conventional therapies, we've talked about integrative therapies, and I thought I'd bring up some functional approaches as well. And this is when we really get into personalized medicine and the, what's coming over the next century with being able to look at things like genetics. So what we understand now is that we're starting to pinpoint some of the genes that increase risk for depression, and some of these are related to methylation pathways. You may have been tested or heard of an MTHFR gene mutation, and this has to do with methylation and folate pathways. And when there is a genetic mutation called a single nucleotide polymorphism, those enzymatic pathways don't work as well. And so if we can detect that, and if we can correct that, then again, this is another way to more naturally treat anxiety and depression instead of just jumping to our conventional therapies. So these can be tested, a wide array of different testing types out there. Another thing that has a lot of research coming down the pipeway is looking at the intestinal microbiome and its correlation to mental health. So what we're understanding more and more is, again, none of our systems are in a vacuum, right? Everything in our gut, from the food we eat to the type of bacteria, can also affect our health. In particular, the microbiome, we're now understanding that the bacteria in our gut actually create neurochemicals themselves. So the example I've given here is that lactobacillus makes a compound called GABA, which is a neurotransmitter. And so, the implications for mental health on this are huge. If you have an imbalance in the microbiome, bacteria in your gut, are you not getting the correct neurotransmitters that you need to be from that source? And so the questions of what we do with this are still out there. One interesting study is I have down here. And so basically what they can do, they can look at this model a lot in mice. And so they're able to actually breed mice so that they are birthed in kind of a completely sterile environment, and they have mice that have no microbiome. So they take those mice, and then they can give them a microbiome from another type of mice. And so in this case, they took force-fed diabetic mice, and they took their microbiome and they put them into this mice group without a microbiome, and they watched what behavior changes took place. And they found that they were actually seeing a consistent pattern of social avoidance. So saying that could be the equivalent of anxiety or depression in that mouse model. So again, a lot of work to do in understanding this, but it's very interesting that we can change behavior just based on the bacteria in our gut. So what can we do functionally with this? How does this apply right now? We can look at the microbiome. We can actually look and tell you what species you have in your stool. And it is actually possible now to, based on your microbiome and your symptoms, to actually create a probiotic that's specific to you and could potentially then help some of your symptoms in that way. So there's a lot of cool things that are going to continue coming out of this when we talk about a personalized approach to medicine, looking at your genetics and your particular makeup, and tailoring treatment recommendations based on that. All right, so actionable steps. So we've talked about a lot, but the basics here, if you're currently experiencing symptoms of anxiety or depression, or a loved one is, seek help. Don't feel like you have to do this alone. There's so many resources out there, and I'm going to give you some more here in just a second. Have a medical evaluation. Go to your doctor, ask some of the questions that we've talked about today. Become educated on yourself, your biomarkers, your health status, how you're scoring, so that you can make more informed decisions on how you want to treat it. And discuss the treatment recommendations. Ask questions. There's not just one answer out here, not one right way to do things. include some integrative treatment strategies. So again, exercise, diet, nutrition, supplements, botanicals, okay? They're all gonna be part of a strategy. And then the idea would be to put your symptoms in remission and prevent future episodes. So as far as resources that we have here, obviously you've got your own doctor. I have included a suicide hotline here, and this is a national number that you can call if you are having thoughts of self-harm. Just know that that exists 24 hours a day. We are very fortunate to have the Recovery and Wellness Center of Eastern Washington here in town, and this is a mental health clinic that does free assessments for anxiety and depression. So you can call and get scheduled and kind of have an assessment with a therapist and maybe talk about, you know, some therapy options. They do also offer depression and anxiety treatment groups for both adults and teens. So that's something that you can look into as well. And then of course, here at Empowered Health, we are a resource as well. So telling you just a little bit more about Empowered Health. Again, the goal is to really shift the focus back to you. We have patients that come to us all the time that are just really frustrated with feeling like they don't have a partner in their health. They go see a doctor, it's a 5, 10, maybe 15-minute visit. They don't really get to ask questions or feel heard, and then they get a quick treatment plan that they don't necessarily feel good about. And so what we've done is created space and time. And in our model, we're able to have a 90-minute new patient appointment. And so we talk through, what is your lifestyle? What are your concerns? So just know that we're here. I do primary care and then also consults. So if it's something you're interested in, we do offer inquiry calls. And so it's something you can schedule on our website. So 20 minutes to have a phone call with me and talk about how it might be a good fit for you and what sort of, you know, how you might plug into the clinic. If you liked the tips that you heard today and you're interested in just hearing more about health and wellness and what else is out there, you can go ahead and follow us on Facebook, Instagram. We also have a monthly newsletter that we send out where we give a lot of similar treatment tips, actionable items, things that you can take and implement right away. We are going to be making this presentation accessible on our website. So if you would like the slides so that you can, again, take that to your doctor and write down, you know, the different blood tests that I recommended or can't remember the name of the supplements, and it's all going to be here for you to get access to. So we'll make sure that you have that. So with that, I'm happy to open it up to questions. I also did, you know, in case you're interested in the site, the sources that we have here, it's all in the presentation as well. So Logan, any questions that I can answer?
I think, can you hear me?
Yes.
Perfect. So looks like we're good. We have one question that came in through the Zoom chat. And this may be a call your insurance question, I'm not sure, but Kim is wondering if your practice accepts CHAMP VA insurance.
So it's a great question, Kim. We are a membership practice and we are a cash-based service. So we don't bill insurance, but what we do provide is a super bill so that you can bill your own insurance. And so there's the option there, but we do not directly do the billing.
All right, and I think that is it. So that means you answered all their questions through your presentation. So perfect. So as we close, I do just want to say thank you, Dr. Schneider. Thank you to your staff for helping coordinate this entire presentation. I know that you and all the other healthcare workers are just slammed right now. And so I just want to say we appreciate your time and everything you do for our community. And to the viewers, just a reminder, our next sessions are going to be next week, next Wednesday and Thursday. We'll have Facebook and Instagram marketing with Zach Mason and Krista Patterson. So stay tuned for more information there on our website and Facebook page. And as Dr. Schneider mentioned, this presentation will be made available on our YouTube channel and our Facebook page. And then as well as, I believe Dr. Schneider's staff will be working on the video, putting on her website as well. So thank you all for attending. And